Navigating the home health process could be very confusing, especially in the beginning. You just got out of the hospital, you or your loved one, or sometimes you're being discharged from a skilled nursing facility. The first step is actually that discharge. Usually, there's some kind of discharge planning with the facility that you're leaving. During that time, they will either choose a home health agency or give you the option to choose a home health agency. And then we also have to get orders from the physician at the facility or your primary care physician. Either a nurse, sometimes a physical therapist will do what's known as the OASIS admission or admission visit. And then in that visit, they'll get like all your information. It's usually the longest visit that you'll have. That week, right? I call that like your evaluation week. So it's really busy. You'll have PT sometimes, an OT, it could be an SLP, a home health aide, and a social worker can like all come and see you that week. When you're in the hospital, you kind of always have a provider, hopping in and out of your room. Just kind of think of it like that. And it's kind of like a provider's kind of always hopping in and out of your home. Just know that everyone's there to do a job and everyone's there to take care of you and or make sure that your caregiver understands what's going on. The most confusing thing for patients is usually scheduling. It's also confusing for us as providers. Me as a therapist, speaking for myself, I can never give an exact time. Like, I always give a window. For example, I'll say, oh, I plan to arrive between the hours of 12 and 2. I would never say like, oh, I'll be there at 12 o'clock because I never know what's going to happen. I never know what's going to happen with my patient prior to that visit. And I never know if there's going to be like a lot of traffic on the road or if I need to stop for something. So I just always give a window. And I do find that that is something that like really overwhelms patients because they like to know exactly what time someone's coming. Another issue is change in providers. There's not a way for to consistently always be the same provider that comes every week. Sometimes that is possible. I always say just look out for like an occupational therapy provider that will come for the next visit because it could be me, it could be another therapist, it could be a coda. We do try our best to keep it consistent, but sometimes it's not going to always be the same person. So that's it for now. I hope that this helps just a little bit for anyone who may be new to home health or navigating the home health process for the first time.